Bismillahirrahmanirrahim. My dear student, welcome back to third year oral surgery. My first lecture is Exodontia. What's the definition of oral and maxillofacial surgery? It's a specialty, it's a subspecialty or specialty in surgery. We deal with diseases, injuries, defect in oral and maxillofacial area. This is any disease like cancer, we can remove it. Injuries like fracture, injuries to soft and hard tissue, and defects like cleft lip and cleft palate and others. What is the meaning of exodontia? Exo, it means out. Dontia, related to tooth. It means that at the end is the tooth out extraction. So we deal always, we need to do an ideal tooth extraction without any trauma. What is the meaning of ideal tooth extraction? It means painless extraction. Painless extraction, first requirement, because otherwise the dentist or the surgeon must give a correct technique, use correct technique to secure anesthesia so the patient does not feel any pain during tooth removal. So it's painful removal, painless removal of the whole tooth or root, and with minimum trauma to the investing tissue. It means no need or minimal. There is always trauma. It's traumatic. Extraction is traumatic. However, but the dentist or the oral surgeon must do his best to make the area least affected by a traumatic procedure. So when you do it with minimum trauma, there will be wound healing, easy and quick wound healing, and we might no post-operative prosthetic problem. You know, we need to do dentures. We need an ideal ridge. So if you do trauma, if the tuberosity broken or any bone broken, so there will be a defect in the denture bearing area, which affects future denture construction. We have now the method of extraction, how we extract the tooth. We have intra-alveolar, or other meaning is forceps extraction. In this, we remove the tooth or the root using an forceps or elevator, or both of them. So as you see here, we use forceps, and here elevator to laxate the tooth prior to the using of forceps. The second method of extraction is transalveolar. It means surgical. We must remove some of the investing one, and then we use the forceps and elevator for extraction. We use it here in impaction, impacted third molar, impacted canine, any tooth impaction, we use this technique. Principle of extraction. How mechanical principle of extraction, how the forceps and elevators work. Number one, expansion. Here by dilating the socket, we move the tooth buccally, lingually, or labially, palatally, to dilate the socket for tooth extraction, and this is done. We use the same tooth as a dilator. This is the main principle of forceps. Also, other principle of its wedge. We put the blade of the forceps between the alveolar bone and the tooth, so the tooth can be extracted. Here is the same picture for mechanical use as a wedging or expansion of the socket. The liver and fulcrum, we use force the tooth or the root to be out of the socket at least resistance. What's this mean? As you know, the labial and vocal height of the upper maxillary teeth, it is thinner than palatal. So the least resistance is the vocal or labial side than the palatal side. So in this way, we use the elevator as our force is the force and the resistance by the tooth. And here we use the fulcrum by alveolar bone as a fulcrum. However, if you want to extract two teeth, we can use the other tooth as a fulcrum. Insertion of wedge, as you see wedge here, we use between the tooth or the root and the bony socket. As you see here, we put coupling chisel. We can use coupling chisel for this technique, and we create point of application in the alveolar bone, and we can take the tooth out. Okay, so sometime when we put the elevator in this way, maybe sometimes conical root will be come out easily. Sometimes shoot out of their socket when the forceps blades are applied to them. So now we move to indications of extraction. There are so many indications for, however, we can save the tooth by other technique, by according to the case. So, if we have grossly carious tooth, we cannot restore it by any dental procedure, root canal or something like that. We can extract the tooth. Pulp pathology conditions such as chronic and acute pulpitis also, and we cannot do a root canal or the patient refuse. So in that way we can extract the tooth. The third one, periodontal disease. See here, if we have acute or chronic periodontitis, and the tooth is mobile, so it's a source of infection, and we cannot save it by any way. So we must extract it. Non-vital tooth. If the tooth is cannot be treated endodontically because the possibility it will be a cause of infection. It's focus of infection, especially in debilitated patients. So in this way we can extract the tooth. Presence of periapical lesion, such as periapical abscess, as you see here, if there is periapical abscess or granuloma, especially in the posterior teeth, we must extract the tooth. Traumatized tooth, if we have fractured tooth in the cervical part, or other area, if the tooth is mobile, so in this way we must extract the tooth. Tooth in line of a fracture, the fracture line. Tooth here, as you see in the fracture, is source of infections. So, and it will cause a delay of healing of the fracture, so we must extract this tooth. Retain this tooth, it will affect the permanent tooth. It will be the permanent tooth will appear out of occlusion, labially, palatally, lingually. So we must extract it before the eruption of permanent teeth. Supernumerary, if you have an additional tooth, no need for it, and it's not in occlusion, it causes crowding. In that way, we must extract it. Impacted tooth, if you have impacted third molar, painful, or this periphoronitis and other disease, we must extract it. And pain, very curious, if it is curious, we must extract it also. Malpose tooth, if the tooth is not in its normal way and cause area, it will cause aesthetic disturbance, so we must extract it. A prosthetic consideration may require to remove one or many teeth because it affects the design and the stability of the denture, so it needs to be extracted. Orthodontic consider may require the removal of a tooth if we have an erupted canine and there is no space for canine to be in normal occlusion. In this way, we can extract premolar, one of premolars, and to do a space for eruption of canine. Before radiotherapy, if any patient has radiotherapy after cancer treatment, the physician refer to the dentist if he has any tooth to be extracted or filled. This is because radiation will cause obliteration of the further obliteration of the blood vessels, so it will affect cause infection or delay healing. Any retained root must be removed to prevent infection. Any retained root must be extracted.